Good morning, everyone. I'm going to call the SEB meeting for March to order. Welcome for everybody who's on site here at Cherry Street, and for folks who are joining us online, it's great to see you. Our meetings also just a matter of logistics notes. Obviously, they are virtual, and so we have the healthcare authority that's on staff managing things in the room. And we also have staff here helping attendees or members of the public who are also attending virtually to be able to navigate that virtual environment. The opening slide has information for folks who are joining us virtually on how you can turn on closed captioning subtitles for support and accessibility in that regard. The process, we are still transitioning. I think there's our second meeting on Teams, so we're transitioning from Zoom. It's a little bit different. Also, I just want to note for anyone joining from the public, and this is particularly important in terms of the public comment portion of the period, you'll only be able to activate your audio and or your video during the public comment period. But if you have signed up for public comment and or you wish to provide public comment, you'll be able to activate your audio and your video at that time as part of the meeting. For board members attending in person, your voice only gets picked up if you select your green portion on your mic in here for folks who are joining us in the room. So make sure that you utilize that as well. And now that Pam is back with her coffee, I think we can do roll call, right? Okay. Pam was
Way to call me out.
Oh, good. We have to have sustenance.
Yes.
Okay, so I will do roll call. Carrie Schaefer.
Good morning.
Pam.
Good morning with coffee.
Yes. Laura Christopherson.
Good morning.
Allison Polson.
I am here and accounted for.
Great. Donna Hanson Murray.
Good morning.
Wonderful. Omid Hadari.
Good morning.
Good to see you, Omid. Terry House.
Good morning.
And then we also have Katie Hatfield from the Attorney General's office.
Hello, everybody.
Morning. And present for myself, last time I checked at least, Ryan Moran, Director of the Healthcare Authority. I will just note that we have a series of presentations today. So this meeting is a little bit shorter than the January meeting that we had for the retreat. The presenters, as is custom, are going to run through their presentation. It's helpful if board members hold their presentations to the end. Also, board members who are attending virtually, for a matter of logistics, you can use your little raise your hand icon when we get to the portion when we are asking questions. And if the public, for any reason, has questions that they want to specifically ask the presenter, the agency has put the presenter's contact information in the slide deck so that you can reach out to them individually at the end of their presentation or at the end of the meeting, and they will ensure that they are responsive to your request. We welcome, this is a public meeting, and also this is your government, so we also welcome the public to email the presenters to capture any questions that you may have for responses in that meeting. We have, I'll just make a note, no formal resolutions that are scheduled for today's meeting. And we also have a designated time in this meeting for public comment, and that is for members of the public to provide general comments at the end of our discussion. And I will just note, because I like to do that for a matter of timing for individuals who are joining the meeting, we expect that public comment period to happen at around 11:20 today. So if you are interested in public comment, around 11:20. So with that, I think I am going to turn it over to Dave to give us an overview of what we are going to discuss today as a board and today's agenda.
Right. Good morning, Chair Moran and members of the board. Dave Eisminger here. We'll start off with approving some minutes. We try not to have any action at the retreat, so we'll visit last year's last meeting minutes, the retreat minutes, and then move on with a presentation about where we are in the legislative session. There's about a week left, and so additional proposed budgets have come out. Bills are passing and not passing every day at this point as we round and near the finish line. So we'll have a legislative bill and budget update. Then we thought we'd have a presentation by Dr. Schultz about kind of vaccines. This is picking up a little bit on some of the conversation that was happening during the panel discussion at the last board meeting. So just wanted to share some information there. And then although the board doesn't have authority related to the flexible spending and dependent care assistance program benefit, it is a benefit within the SEB program, and there was a new benefit that was launched under the collective bargaining agreement 2 months ago. And so we have a presentation to talk about that benefit and just have general awareness for you and the public about it and answer questions around that. Then we will continue our newest tradition of talking about benefits 24/7 at every meeting and having a presentation from our CIO. That's generally what we're doing today. Just a reminder, if you need the bathroom, head down the hall. If you see elevators, look to your left. If we have an emergency, we walk purposefully across the street to where Pam picked up her coffee in the visitor parking lot. Yeah. And with that, I will turn it back over to you, Chair Moran.
All right, I think we have two meeting minutes for approval for two separate meetings. The first is for the July 16th, 2025 board meeting, as well as the minutes for the board retreat in January. So I will pull your attention to tab 3, where you can find those meeting minutes start. We'll start with a formal discussion and vote on the July 16, 2025 minutes. Are there any comments that the board wants to make in review of those minutes? And do I have a motion to approve the minutes as written?
Pam Cruz, I move to approve the July 16th, 2025 minutes as presented.
Motion on the floor to approve the minutes as written for the July 16, 2025. Is there a second?
I will second. Allison Polson.
Excellent. All in favor, say aye.
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 Any opposed? I'm going to abstain from approval because I was not here for the July period. So I'll just make that known. Okay, and then thank you. So then the second separate vote will be for the January 22nd, 2026 retreat minutes. Are there any comments from the board in the review of the minutes for the January 22nd retreat meeting minutes? Is there a motion to approve the minutes as written?
Pam Cruz, I move to approve the January 26th, 2026 minutes as presented.
Motion on the floor to approve the minutes for the January 22nd, 2026 retreat meeting minutes. Is there a second?
Allison Polson, I'll second that.
Excellent. All in favor?
Aye.
Are there any? Wonderful. Are there any opposed? January 22nd, 2026 minutes are approved as written. Great. Thank you. All right, we are going to move into the legislative session and budget update. I'm going to the great privilege to bring up Cade and Tanya, who are going to give us a legislative session update and a review of the supplemental budget. I will say we have 7 days left in this short legislative session, and I just want to thank Tanya and Cade for their expertise and their work this legislative session. And you're going to hear a little bit about what they have been up to, and we have a little bit more sort of line of sight where things we think are headed in terms of the budget discussion as we move into the last period of this session. So Cade and Tanya, I'll turn it over to you.
Great. Thank you, Chair Moran.
And tab 4, board members, tab 4.
Thank you. All right, we'll get moving along. I'll try to be brief on these. There's not as much active legislation moving right now, but we have had a significant amount of legislation this session. Next slide, please. Here's our breakout of the work we've done this year. Actually, as of today, we're up to 150 bills that we have done analyses on. And just by way of context, last year we had 134 bills total out of the long session. So in this short session, we've actually cranked in a lot more work for our team. So shout out to the team in ERB that's done the analyses on all of these. So each one of those analyses takes between 2 to 10 hours between coordinating with the staff internally, reviewing the legislation, writing up the bill analysis, having the approvals be done by the various managers, coordinating with different divisions for additional information that might be pertinent for the analysis, working with external stakeholders like our carriers. So there's a lot of work from the team to get all that work done. So this chart represents probably thousands of hours worth of work by our team to be reviewing things for this session and providing information to the agency and to the legislature about what's being done. Also, just a note for Tanya and her team, up to 76 fiscal notes this year. So over 50% of our bills have had fiscal notes attached to them, which is I would say a very high number, especially given this short session. So next slide, please.
Kate, I just want to add, you've highlighted the amount, you always do a good job of highlighting the amount of work that goes in just from our division at just our agency. And a reminder to everyone that is replicated across all state agencies and higher education institutions and many school districts throughout the state. I once was told by a legislator who's still the legislature, to drop a bill cost at least $10,000. I think that's a woeful underestimate, moving forward, even inflation 15, 20 years from when that statement was said to me about the amount of cost there is that is associated with bills. And so, just a reminder that, there are thousands of bills and many agencies. Not every bill is reviewed by every agency, but certainly multiple agencies are involved in most bills. And it is a significant amount of time and resources for the state to be able to review the ideas. And it's an important part of the process, but it does have a cost.
And the Healthcare Authority alone can track up to almost 1,000 bills per session easily across just our agency.
Yeah, money.
And time.
Time is money, money is time. Next slide, please. So here's our how a bill becomes law progression. In fact, this is because we have to get the slides turned in a week before. This is a little outdated. We've actually seen one of our high priority bills that we've been tracking has made it all the way through. Is sitting on the governor's desk. I'll talk about here in a second. But these are the high priority bills that we're tracking. Now, you might see some discrepancy between the high priority bills on the previous slide and this one. The numbers, if you're Dave, the numbers don't necessarily number perfectly. That's because when the number of bills that we're analyzing includes all the different iterations of that bill. So it might have the same bill number, and as it gets an amendment or a substitute or an engrossment or a second amendment or a second engrossment or a second amendment or engrossment of a second amendment, all these other fun titles that go on the end of those, the front notation of those bills, we consider those each an individual analysis. But the legislation itself, because of the rules of legislature, that the title of the bill is what carries through. That's why you only see here the 12 bills of high priority status that we've been tracking. So we'll move on to legislation. This will be a lot of new bills that since the last time we spoke, because it was very, very early in session. But what you'll notice is that I've put them on the slide because of interest, but also if they have not moved forward this session, I've struck through them, just so if the legislation is still moving in one of its forms, either the House version or the Senate version, it's there. But otherwise, if it is dead, it is no longer moving, I've struck through it. So I've just made a note on here, and we'll just for your information. So. We did see the legislation that I had spoken to you about, 2160. Just a couple of notes on that is not continuing to move forward this session, and will be dead, and we'll have to see legislation reintroduced. But this was of note for this board. It would have amended the eligibility in the SEB program for a lot of part-time employees in the SEB program. So I'm sure you all are probably a little bit aware of what was going on there, and the efforts that were being made by some of the legislature to amend how our SEB look-back rules were doing. Currently, our rules are a 2-year look-back rule for your eligibility. If you're not presumed to be eligible for benefits, this legislation would have changed that to a 1-year look-back, which would have been advantageous to a lot of employees that don't have as much longevity in a particular district. It also had some other aspects of it, given the way it was written, that would have made it far more complicated, because it would have allowed for cross-district eligibility based on the type of job classifications. But it did raise some issues for us, some aspects for us to be considering, like how we might be able to capture or correlate our data collection that we have on employees, and use some of the job classification types that are used by OSPI in classifying employee types, and seeing if might be some opportunities for us to incorporate some of that methodology or that terminology in our data collection that we do under Benefits 24/7. So I don't know if Dave, if you have any other things you want to add about that. Okay, so I'll move on. I'm just going to highlight the bills that are moving forward still. And if you have any questions on the bills that aren't moving forward, please feel free to stop me. But I will try and be brief by just moving forward on the bills that are currently still moving. We have House Bill 1069, which was actually introduced last session, which allows for collective bargaining over contributions for certain supplemental retirement benefits. In its current iteration right now, that bill will only apply for populations that are at the Department of Corrections, and allowing them to negotiate for certain retirement benefits. And that one has passed through both the House and Senate. It's now back to the House for concurrence on the amendments that have been made on it. So we'll expect to see that pass through and on the governor's desk shortly. Moving forward on the next slide, we have Senate Bill 6210, which is a ERB. We are the lead analyst for the agency regarding health plan certification process and creating some requirements that the OIC will have to put into their code about how health plans are certified and some additional requirements that are placed there will have minimal impact on our plans and our programs, but just something we're tracking anyways, given that we do the commercial insurance in our division. Next slide, please. House Bill 2242, that has passed, is sitting on the governor's desk currently, which is preserving access to preventative services by clarifying state authority and definitions. I think we'll be hearing a lot more about this from Dr. Schultz here momentarily, or in the topic of things as it relates to the changes by the federal government on the vaccine recommendations and the work that's being done jointly between California, Oregon, Washington, and Hawaii on dealing with vaccines. And so this is codifying in our state statutes, the efforts and what's being done to address some of the recommendations on vaccine schedules. Then we have Senate Bill 6183 concerning expanded coverage and for HIV antiviral drugs that has continued to move and has passed and is on its way to the governor's desk here shortly. It just passed out of off the House floor last night. Next slide, please. We have Senate Bill 5981. This is providing some protections for access to the 340B drug pricing program. And I apologize, I can't go into much more detail than that as it's a little outside of my area of understanding, but it's something that's really in making sure that this federal drug pricing program, the accessibility remains, and we're able to take advantage of that program for our commercial plans. Then we have Senate Bill 5395, improvements to transparency and accountability for prior authorization. It's good to see that this legislation is continuing to move forward as it continues to make efforts on simplifying or creating more transparency, as the bill says, on the prior authorization process with commercial insurers. And that is it on the active legislation that's still moving through. So I'm happy to take any questions if you have any. Record time for me.
Questions from the board for Cade?
Are they gonna get done on time?
I mean, you can go check out call sheet for that and see if there's any what's going on with that.
I don't think we want to risk
I'm
putting
not on it
anything
right
in the
now.
universe.
Oh, okay. I take it back. I don't have a question.
Thanks, Cade. Tanya, we'll turn to you to talk about the budget.
All right. In similar fashion, mine will be pretty fast also.
I guess this topic is more germane to your question, Allison.
Yeah. Yeah. All right. So I know every time Dave asks a question like that, I'm like, don't put it in the universe. Okay. So last time we talked was kind of right at the beginning of session, and we had a governor's budget. Well, we now have a proposed House and Senate chair budget. Those came out on Sunday, the 22nd, both on the same day, which was kind of nice. So we're going to just walk through where we are there. We're going to skip over the timeline because it's the same. I think really the exciting news here is that our decision package related to our benefits 24/7 IT resources was funded in both the governor's, the House, and the Senate. So for us, that is usually a really good sign that this is going to make it all the way through to the end. Again, anything can change in the final conference budget, but the fact that all three are in alignment and funded this decision package at $1.8 million for the next 3 fiscal years is a really good sign that we can kind of dig in on this work a little bit and start planning for the funding to come through in the final conference budget. Dave, anything to add on this one or?
No, I'm very pleased about this particular development. We've talked and Travis will talk a little bit later today and show you some visual examples of how data flows in our system and how our systems, how many system exchanges there are, and there is a significant amount of modernization that continues to need to happen. The way I think about it now is I kind of always make a little joke about this, like, back in the Ford administration was when our IT system was created. And a lot of IT standards predate when cell phones were ubiquitous. And so there's just so many times whenever we're talking about our IT systems where we go, when was that created? And you think about where technology has advanced over just the past few years, let alone when you expand that to decades. And so this is an area where in the past, there's been some struggle to get buy into the importance of funding to make some of these incremental changes. And so for it to be in all three budgets, usually that means that the things that are agreed upon aren't further discussed. And so we're really optimistic that the work that we've already been putting in place, leaning into this, hoping that this supplemental budget would have this authority, would allow, we've been leaning into that work and now we feel even better about leaning further into it until this funding actually picks up in July, once the budget is passed and signed. So very pleased about this.
Really pleased about this. Something I'll note that's not on this slide is a reminder that we didn't put forth a bunch of decision packages in the PEB and SEB program for the supplemental budget this year. One, we like to hold larger changes for a biennial budget. As well, we were really aware as an agency of, the state of the budget and really trying to limit those additional requests. So the fact that we did get this in that environment is really great, but this is the only one that we will be probably talking about when we get to the final conference budget. In addition, at the last meeting, you heard me talk a bit about administrative reductions that were considered for the governor's budget. In the House and the Senate, I don't have a slide on it because there were none that were implemented for the PEB and the SEB funds. There are some agency level reductions to our general fund budget, which ultimately, depending on how things play out, could have an indirect impact on the PEB and SEB programs downstream. But as of the current versions of the budget, there were no direct line items for the PEB and the SEB funds for further administrative reductions, which is also great news for the program. So the next slide is all about the funding rate, and this is where the majority of the work that really doesn't get talked about or exposed. This is where a lot of the conversations with ledge staff and OFM come in. And equally, we have good news here. They took our recommended funding rates in both the House and the Senate proposed budgets, which is really great. They didn't push back on trend or any of our other assumptions underlying these numbers. You will note that for school year 27, there is a slight difference between the Senate and the House. And you might say, Tanya, you just said they took our numbers. They took our recommended numbers with the exception of the Senate, which did a reduction to the Medicare explicit subsidy. So on the PEB side, there is the funding for all of our Medicare retiree subsidies. The SEB program pays into those as a component of their funding rate. It's called the K-12 remittance. It's on average about $70-ish currently. And of that, the majority of that goes to pay for the Medicare explicit subsidy that is paid out of the PEB program for school employee retirees, and the remainder is for the non-Medicare retirees. So that money is part of the SEB funding rate and gets moved to the PEB program every month to pay for those retiree subsidies. In the PEB section of the budget, 904, the Senate has reduced the Medicare explicit subsidy from $183 to a $150 cap. Both are 50% of the premium or the cap, whichever is lesser. But the Senate made an assumption to reduce that explicit subsidy, which impacts the funding rate by $7. So that is what the difference is. So we will see that's the main difference we are tracking on between the House and the Senate budgets for the PEB and SEB programs. And that is really the only difference we're seeing in both the House and the Senate and the PEB SEB budgets is really their position on the Medicare explicit subsidy. Questions on that? Because we don't really talk about that a lot at this board. Okay. Allison.
Could you just say it one more time of what it exactly is? I don't know that I have any particular questions. I just don't think I quite
since we have a little time, we'll just do a little bit more level setting. So when you retire from K-12, your retirees from the SEB program move to the PEB program risk pools, right? And when you are Medicare eligible, you get subsidized for your Medicare premiums. Right now, and for the last few years, it's been set at $183 or 50% of the premium, whichever is lesser. The Senate has proposed reducing that to $150 cap. But we charge equally all of the groups, the employer groups that are in PEB, we charge the PEB agencies, as well as the SEB employers for equally the portion of all retiree costs. So as part of this the current 1307 funding rate that we're paying today, about $70 of that goes to the PEB program to pay for that $183 subsidy, as well as the non-Medicare retiree subsidy, because when you're non-Medicare, you're rated with early retirees who also receive an implicit subsidy. Does that help? Yeah, so Senate's reducing it, which means we're reducing that component of the funding rate for SEB.
And from a policy standpoint, is it just a budget savings, or is there more to behind that kind of decision?
I think it is a budget savings mechanism. So when we presented to the board last year, we had a giant list of agency reduction options to help support budget reductions, most of which are tied up in collective bargaining agreements. So there's not a whole lot with employee benefits that can be achieved within the current biennium. Any savings to employee benefits has to be bargained and would be out in the 4-year outlook, not in the immediate biennium. Last legislative session, they took the things that could be done immediately to impact the budget. We closed our ACP programs. We are eliminating Smart Health in the out years. We had some agency administrative reductions. We freed up our reserves for both the employer paid long-term disability as well as our premium stabilization reserves. So last session, they kind of took everything that they could grab immediately. This was really one of the only things remaining on the list that they could grab to impact the current biennium. And because it's in the budget bill, and lives and dies in the budget bill, they have to readdress it every single year, and they have to put the year on it. So it says for 26, it will be 183, and for 27, it'll be 150 in the Senate version. So they'll have to readjust it for the next biennial budget because it lives and dies in the budget bill.
And is it not collective bargain?
Nope.
And it couldn't be?
Nope.
Okay, so this is the state's commitment. The state gets to make that decision.
Yeah. Yeah, and I think a lot of times they're balancing it on pension COLAs too. So they'll look at kind of the retiree package as a whole and kind of look at where the subsidy is. One other consideration that is a little complicated is we used to qualify for what's called the retiree drug subsidy through CMS. And basically we got $20-ish million back for subsidizing our Medicare retiree premiums. When we converted all of our Medicare plans to Part D, we no longer qualified for the retiree drug subsidy, but for that $20-ish million that goes to the state general fund. We didn't get that as a program. We sent it straight to general fund. However, the savings to member premiums were so significant that the legislature said, yes, board, PEB board, go forth, forego the subsidy, convert your Medicare plans to Part D and lower those premiums for members, because now we get to leverage the federal Part D subsidies and bring down our Medicare premiums. Historically, that $183 was always set at a level to make sure the state could continue to qualify for that $20 million-ish subsidy. But because we no longer have to what we call chase the subsidy, there's less pressure to continue for the legislature like constantly chasing that cap. That dynamic is removed. So it's really about kind of the retiree compensation package, not about chasing the subsidy. When we chased the subsidy from it was 150 historically, then it was 168, then 183. When we did that jump to maintain qualifying for the retiree drug subsidy, we actually spent more in subsidy costs by increasing it to even get the 20 million back. So it became a game of we don't need to continue to chase it. We were spending 220 million to get back 20 million. We don't need to do that anymore. Members benefit from the lower Part D premium significantly. So I think this just came up at a time where they do need to impact the current biennial budget. This is something they could do for plan year 2027 immediately. Grab those 6 months of savings in this current biennium. Yeah.
Thank you.
You're welcome. That was a lot.
The only piece that I just want to put a point on is when the legislature decided it was fine to in the future forego chasing the RDS subsidy, it was to replace it with access to even more valuable subsidies that directly impact members. So they gave up the $20-ish million coming to the general fund so that the structure of the benefit could access more lucrative federal subsidies that help the retiree member premiums. So it was a multi-year conversation with the PEP board.
Any other questions from the board?
Well, we will see you with the final conference budget and hopefully it doesn't look much different than what we have today.
Yeah, the only other thing I'll add that kind of tends to happen as we get to the conference budget is when there are collateral debates on bills that are going on in the legislature, sometimes new reports are inserted at the last minute into conference budgets. When they decide they can't pass a bill on a certain topic, they'll decide to do a study. So you might remember, I think it was last meeting, Cade was disappointed that he had no studies. Hold on, Cade, there's still time. So yeah, there's still time for more reports. So that's the other X factor that we will see sometimes is that gets added into the agency's to-do list. So.
Thanks, guys.
Great. Thank you, Tanya. Appreciate you and Cade. All right, we're going to move. We're running ahead of schedule, which is great. Never mind that. But we are going to move ahead towards bringing up Dr. Heather Schultz, who is our medical director for the ERB division, and she's going to provide a general overview of the SEB's program's vaccine coverage. I'll just take a point of privilege and just say a couple things. One, this subject was brought to the boards, is coming to the boards, obviously because of the volatile climate that we're finding ourselves in terms of the changes that are happening at the federal level related to vaccination coverage, but also wanting to be very clear for the PEB and SEB members what hasn't changed, what does remain the same in terms of our coverage, how the state and we at HCA are partnering with the Department of Health. Kate talked a little bit about that in terms of legislation that's advancing this session, and how we are ensuring that people know that vaccination coverage remains intact. Here's how we as a state are being guided in terms of our work in this particular space as we navigate that climate. And so with that, I'll turn to Dr. Schultz. I'll just say also, it's been a pleasure to get to know Dr. Schultz, and I'm really been impressed and admire her leadership. And I'm really grateful that she's at HCA during this time to help us lead our employees and school employees through a number of this different volatile changes from the federal outline, making sure people have the coverage and services that they need. So thank you, and I'll turn it to you.
Thank you, Chair Moran. Good morning. So as described, I'm going to walk through first just describing what's changed. There has been so much in the news. It's hard to keep track of. So we're going to just start with the background of what's changed, how those changes came about. Then we'll get to what's the current state of coverage that we have with some examples. And then we'll close out by talking about what to expect for the future state. So there has been one big change to vaccines in the last year, and that is federal government recommendations. So starting in 2025, the Department of Health and Human Services, which is the federal agency that ultimately makes recommendations about the federal vaccine schedule, started making piecemeal changes and then ultimately a larger change to the entire childhood vaccine schedule. And what's noteworthy is that the way the changes happened is different than the typical process that's been in place over about the last 2 decades. So as noted in that last bullet point, the Advisory Committee on Immunization Practices, that's an external body of experts who in the past have made recommendations to the CDC, which is the Centers for Disease Control and Prevention. They are also part of HHS. There would be discussion, public debate, internal review with other federal agencies, and then ultimately the CDC would make recommendations to the Secretary of HHS, and the changes would go through. In the last year, the process has been a little bit different. So there have been unilateral decisions that were made outside of ACIP recommendations by the Secretary without any review. There have been some cases where ACIP has met and done their review. That review process also looked a bit different than it typically has. So in the past, if there were new recommendations that were made about vaccines that had been previously recommended, those decisions were based on new evidence. regarding safety or effectiveness or something that new that was learned. And the changes that have occurred over the last year, those recommendations have taken place without any new data to support those changes. Next slide. So diving a little bit deeper into the specific changes that were made, the first recommendation change was to COVID-19 vaccines. So there had been a broader universal recommendation for initial vaccines and then annual vaccines, and that got shifted to a smaller population of kids where it was universally recommended, and then a sort of downgrade into a shared clinical decision-making and risk factors approach. There was also a decision to no longer recommend the MMR and varicella vaccine. That was a combination product. So MMR is the measles, mumps, and rubella vaccine. Varicella is for chickenpox. And those are typically given at the same age in the childhood vaccine schedule. So there is a product that actually combines the two vaccines together to reduce the number of shots. So there was no change in the recommendation for giving those vaccines, just separating them out. And again, of note, no new data that there was anything that changed about the safety or effectiveness of that combination vaccine. There still exists two single products for those, so those vaccines are still available. And then the big change, there was also a change to the hepatitis B newborn vaccine recommendation, and that got finalized in the large revised childhood and adolescent vaccine schedule that was adopted at the start of this year. And that was, again, a decision that was made without new information. None of the vaccines were actually removed off of the schedule. So it's not that anything was completely dropped, but the previous vaccine schedule had universal recommendations. This new vaccine schedule for the federal government shifts some of the vaccines into a category of these should only be given for certain high-risk groups, or shifts it into what's being described as shared clinical decision-making, which is different from the normal informed consent that physicians have always done when talking with parents about vaccines, but really is an attempt to slide some of the vaccines that were previously universally recommended into a personal preference category. Next slide.
Real quick, Heather, I'll give you a break to say, because of the structure and processes that changed with ACIP and the CDC and HHS that Heather described on slide 2, and kind of the recommendation changes that were made by the federal government that she went over on slide 3, that's what really prompted a lot of the discussion that resulted in House Bill 2242 that Cade was referencing, that has already made it through the process and is on the governor's desk for signature. And the fundamental aspect of that bill is to replace ACIP as the basis for coverage requirements in our commercial insurance law in our state, and transition that to the Department of Health, and giving the Department of Health the authority to set recommendations. So that's really like the concerns about this process and how it has gone is what prompted creating a separate process for our state for DOH, and now our commercial plans, including PEB and SEB, will have to follow recommendations set by DOH instead of automatically ACIP. So that's the core of the legislation. Is there anything else about the legislation that you want to highlight, Heather?
No, that hits all the important points. Exactly. Previous state law referenced ACIP because previously ACIP was aligned with the rest of the medical community in terms of their vaccine recommendations. But with the shifts, we have moved to looking to other sources of evidence-based endorsed vaccine schedules.
And that's really important because that sort of captures what carriers need to ensure is paid for.
Yes.
For beneficiaries.
Yes. So the prior world was our state law said carriers in the commercial world have to cover things that are recommended by ACIP. Now it's will be covered by the recommendations by the Department of Health of our state.
So important also to think about is what hasn't changed, which I like to think of as everything else. Everything else has not changed. Starting with, as Dave was saying, our state's approach to vaccines, and that first bullet point, I cannot emphasize enough. So there has been no new evidence that changes what we know about the safety and effectiveness of all of the vaccines that were previously on the federal recommended vaccine schedule. No new data whatsoever. Another important thing to note is that the Affordable Care Act requires no-cost coverage for preventive services and vaccines. Many of the vaccines that are on, certainly the ones that are on the childhood immunization schedule, are considered preventive. That has not changed, so that no-cost coverage for preventive care is still in place. Also important to note that the American Academy of Pediatrics has a recommended vaccine schedule that they publish each year as well. During my 2+ decades as a pediatrician, that normally aligned with the federal recommendations. This is the first time in my years of practice that they are veering away because they had noted that there is no new additional evidence. So that vaccine schedule looks identical to what it has in the past. And then importantly, also the adult schedule, the federal government's vaccine recommendations for adults have not changed other than the loosening of the universal recommendations for COVID. Next slide. So this slide just kind of brings home, as it says, bottom line, no cover changes. I put together this table of just some illustrative examples. This is not all inclusive, but some of the vaccines that have been in the news lately, just to remind people that everything is still covered. So as I mentioned earlier, ACIP made recommendations to change that very first hepatitis B vaccine, which is typically given in the first 24 hours of life. A newborn who is born in the hospital, eligible for that vaccine, still covered. A 1-year-old child who is going in for their well child check and is due for their MMR vaccine, still covered. A older child who is ready for their annual COVID vaccine, still covered. And then I also put in an example of an adult because I know there's some concern about some of the respiratory virus annual vaccines. Those are also still covered. An adult of any age interested in getting their annual flu vaccine, still able to do that and still covered. Next slide. So what does the future bring? I do not have a crystal ball, but but I anticipate that there will be some additional changes that we see from the federal government. ACIP was supposed to meet in February. That got bumped into March. It's unclear what will come from that, but the stability that we have in the state of Washington is a continued commitment to no-cost coverage for the vaccines that are evidence-based and preventive. So we have not only the CDC and ACIP to look to, we have medical professional societies. So for the childhood vaccine schedule, that would be the American Academy of Pediatrics, and for the adult vaccine schedule, that would be the American Academy of Family Physicians. I called out the West Coast Health Alliance, which has been mentioned a little bit earlier. So during the start of the pandemic, Washington, Oregon, and California built an alliance to have evidence-based foundation for public health during that pandemic. With the changes that started at the federal level for vaccines, that alliance came back together and Hawaii joined as well to provide, again, some foundational evidence-based public health support for preventive things like vaccines. So the West Coast Health Alliance recently endorsed the American Academy of Pediatrics vaccine schedule. So everyone is in alignment, and our state's Department of Health, as mentioned, participates in that alliance. The second bullet point is calling out that there's not going to be any changes to what's covered unless the evidence changes. So during the board retreat, the physicians who were on the panel discussed that it's a normal, regular process of healthcare for recommendations to change when we have new evidence about things. So that's a normal process. We are always reviewing whether the things we do need to be changed because we have additional information, because we know more about a disease process, or there's a new vaccine or a new approach. But unless there's actual evidence for making changes to the existing vaccine schedule, no changes will happen. And then finally, just a reminder that vaccines are still available at all the locations that they've always been offered at. So in that table, the newborn who would be in a hospital, still available there in hospitals. Folks who go for their annual visit or a child who's going for a well child visit, still available in clinics. Pharmacies are still offering them. They're covered at those locations as well. And then if there were any sort of like employee annual respiratory virus vaccine fair, still covered there as well. Next slide. Happy to take any questions.
Questions or comments from the board for Heather?
I'll just say I'm glad I live in Washington and not in some of the other states that are continuing to follow the federal recommendations.
I'll also add a little bit about how we're working on some communications and communication planning for our general population. Kind of previewed a little bit of that, and we had a tiny bit of that discussion at the retreat. The first thing is I thought of this last night. So those of you who are in the room have this in your binders. In the front pocket is a copy of the February member newsletter that was sent. And if you flip to the 6th page where there's 2 people in parkas, I think that's what those are, they're snow parkas, just a high level conversation about what's covered and an intro on vaccinations to the West Coast Health Alliance. And so this was just kind of like the appetizer to start to try to provide some general information in some of our communications. We know that in particular, when we get into the fall and seasonal vaccines come top of mind for many people. Right before we hit the open enrollment season, we're anticipating creating some sort of landing page for the agency for PEB and SEB members. Possibly also Medicaid as well, to be very clear about what's covered and not covered, and then doing some additional like postcard mailings that, talk specifically about the RSV vaccine, COVID vaccine, flu vaccine, and then directs people to this to be created landing page of more vaccine information if they have questions about other vaccines. So we are thinking about ways to make sure, it's always hard to prove a negative. Heather could create 50 examples and somebody would ask a 51st scenario. So trying to get some high level information out there and getting people to resources that are created by the state for them to answer questions about these program benefits. So I did want people to have a copy of the SEB newsletter to see what was there. We did a similar article in the PEB newsletter, and that's just kind of the beginning of this communications aspect for the programs. Laura?
On the topic of communications, I wonder if it's possible, I know this isn't necessarily the SEB, it's more Department of Health, but including something about how to access your coverage, or like what vaccines you've had.
Your vaccination record.
Your records, yes.
Yes.
I'm like, it's escaping me. Yes, vaccination records. We've had a couple cases of measles pop up in the state, and I know some districts that we're all obviously here because we're school employees. So it's a topic that has been brought up recently in the event that a school or school district had a measles incident, what records that they would have to provide their employer to their HR department, and how we can assist them in getting those records more easily. Because right now, when you are hired, you don't have to provide the vaccination record to your employer. But in the event there was a measles incident in a school, there is a need to ask for that. And since that could be very impactful, basically, to a school district. Basically, if there was an incident, we would all have to provide that. And if you could not, you would have to be eliminated from work for at least 21 days and could ripple to many people within that. So just how we can help members or point them to the resources. I know that's more Department of Health, but what steps they need to take in order to do that. And then
I really appreciate that suggestion. I mean, that's fitting the spirit of one of Governor Ferguson's order about the people we serve aren't just in the silo of the healthcare authorities programs. They are served by the state, and the state has multiple agencies, and it shouldn't be our citizens' responsibility to understand what agency does what, and helping provide those crosswalks and collaborating cross-agency to serve Washingtonians as a whole person. And so that's a great example of that. So we'll take that back as part of this landing page that I was describing of various information, because that's a perfect example of something that we should be able to do as a state to help people understand. I'm sure it's much more complicated because like it probably depends on where you were born, and I don't know, so but we can work on something, and the vast majority of people will have probably records here in our state, and so but I really appreciate the spirit of that suggestion, and we can take that back for sure.
Agreed.
Yeah, it's worth, highlighting it, bringing it back up, just because if there was an incident, it would be asked that they would have to provide that, and even go down the road of like tighter tests if they weren't able to do it.
Yep.
So
Thanks, Laura. Omid?
I thank you, Dr. Schultz, for that presentation, and Dave didn't undercut me, but answered my question before it was asked. I did want to ask a question, though, around other preventive health services and whether, if you're aware in this West Coast Alliance and looking forward, if other preventive health care and screenings, if they are changes made against the evidence base at the federal level, whether that would be in the purview and scope of this West Coast Health Alliance to ensure high quality preventive care services for our members.
Yeah, that's an excellent question. And the bill that Dave mentioned also starts the initial piece of that. There haven't been any changes to the U.S. Preventive Services Task Force recommendations, but there has also been some unusual things in that process as well, because they have not met for almost a year, which is not the typical process. Everything's new these days. So in that bill, the current recommendations are kind of frozen with this allowance then for OIC to work with Department of Health and Healthcare Authority to look at new information as it comes in. So there was a proactive attempt in that bill to recognize that we may see some of the same non-evidence-based changes that we've seen in the vaccine schedule also come out of the Preventive Services Task Force. So there is a plan in place for how to address that.
Awesome. Thank you so much for that information.
Thank you. I'll just say too, and I appreciate Dave and folks asking questions around communications and information, because as Dr. Schultz walked through her presentation, there actually isn't a lot that's changed, but the environment feels as if the whole system has shifted in that regard. And so it becomes a responsibility of the state to, obviously, which is what we as a state have done across all our organizations, which is one, to try to provide the best evidence-based recommendations for our residents here of Washington. But where we really need support, right, as we provide this information where we say nothing has changed, that it's validated through community organizations, through districts, through all of our partners across the state, because the confluence of what is happening at the national environment would make it feel, and some of that is purposeful, that the chaos is driven in terms of that messaging that so much has changed, but when really not much has changed actually at all. And so I just appreciate, any of your continued thoughts or ideas about how we as a state navigate that conundrum, because we feel it. And it's definitely a conflict in terms of how to get the best public advice and evidence out there in a moment where you're operating in that environment. So great. Dr. Schultz, thank you so much. Great. All right, we're going to take a quick 10-minute break. And
I would also do, if you want, we could probably do the next presentation and it'd still be before our scheduled break if you want.
Oh, okay. Yeah, that sounds good. Is our next presenter here?
Yep.
Ah, there's Kelsey. Yes. Wonderful. Yeah, so we will move forward then to Kelsey Peel to talk to us about David introduced the collective bargaining flexible spending arrangement benefit that debuted this benefit year for eligible subscribers. So Kelsey is here to provide us an overview of that. We are now moving along and we will be at tab 6.
Good morning, Chair Moran and members of the board. My name is Kelsey Pillay, and I am the Senior Account Manager for the Flexible Spending Arrangement and the Dependent Care Assistance Programs for the PEB and SEB programs. I am here today to update you on the SEB program collective bargaining agreement FSA that, as Ryan said, went into effect earlier this year. Next slide. So first I'll start off by recapping what the flexible spending arrangement benefit structure looks like. So I'll say FSA to keep it short. I'll give a quick rundown of eligible expenses employees can use their FSA on, who the FSA who administers the FSA benefit, and the maximum election amount that employees can elect. So the FSA is a tax-saving benefit, which where FSA funds can be deducted from employees' paychecks before taxes to reduce their taxable income. Common eligible expenses include healthcare costs like their deductible, co-pays, pay for co-insurances or prescription drugs, first aid supplies. You can even use it on sunscreen, vision, hardware, dental services, and much, much more. The FSA benefit is administered by Navia Benefit Solutions, or we just go by Navia sometimes. And the annual maximum election amount that employees can choose is $3,400. They can choose an election amount between 120 and that 3,400. The maximum election amount is subject to annual IRS cost of living adjustments. And after the employees elect their annual election amount, employers will deduct the election amount from their paychecks in equal amounts throughout the year based on the number of paychecks they receive. I bolded this last bullet here to really highlight that funds contributed by an employer do not count towards the maximum election amount. So the bullet highlighted is because that's kind of exactly what we're talking about with the collective bargaining FSA that was awarded to eligible employees earlier this year. Those CBA funds do not count towards the maximum election amount if the recipients were actively enrolled in their own election. Okay.
And they also, those employer contributions, like the CBA piece that Kelsey will go through, don't appear on a paycheck. They don't, it's not a payroll deduction. There's a little bit of confusion about that earlier this year. It's all outside of the process. Also, as you probably anticipate, when the IRS is involved, there's a lot of regulations. There is not an unlimited amount that an employer can contribute. If you cross the threshold, I believe, of about $500 annually as an employer contribution, you start to become a group health plan, and then you're subject to a whole slew of other regulatory environments. So I just say that to temper expectations and understanding that there is a finite limit on the ability for employer contributions on an annual basis. With that, back to Kelsey.
All right. So the great segue into the heart of this presentation, which is informing the board of this SEB CBA FSA benefit for the 2025-2027 collective bargaining cycle. All right. Next slide. So the SEB CBA FSA benefit was bargained for eligible school employees to receive a $200 FSA. HCA designed the benefit to ensure compliance with the collective bargaining agreement, and we contract with Navia Benefit Solutions, the FSA vendor, which in turn they create and manage participant accounts. We work side by side with our SEB organizations and SEB labor unions to communicate about the CBA FSA benefit. And a couple of key points to highlight here about participants receiving the CBA FSA dollars is that they do not need to actively enroll in the FSA to receive the $200, and the $200 FSA will not be deducted from their paychecks, as Dave mentioned. All right. And then this agreement was funded by the legislator in the 2025-2027 budget. Okay, next slide. All right, so I'm going to break down the eligibility criteria in order to obtain the CBA FSA funds. Eligible employees, both represented and non-represented, must meet all the following criteria, sub-bulleted here. So SEB employees must have earned $40,000 or less for the state fiscal year prior to the plan year, as reported to the Department of Retirement Systems, DRS. So for example, state fiscal year 2025, which runs from July 1st, 2024 to June 30th, 2025, the earnings data is used in the fall. That earnings data is used in the fall of 2025 to determine who may be eligible to receive the $200 CBA FSA funds 2 months ago in January 2026. Employees must meet SEB program eligibility requirements on January 1st of the plan year. The plan year runs from January 1st through December 31st. Folks cannot waive medical coverage except to be in a dependent on another SEB non-high deductible health plan. And lastly, employees can't be enrolled in that uniform medical plan high deductible plan since that health plan is tied to a health savings account. And per IRS rules, you can't be enrolled in an FSA and an HSA for the same plan year.
Before we move on from this slide, I'll just, one of the most common questions we've had so far is that this is a really complex eligibility piece, and how did it really come from, and the difference between a state fiscal year and a school year and a plan year for calendar plan year. And what I'll say is, there's no perfect data set in the K-12 world. I'm going to look at Laura, and she's kind of covered her face smiling, yep. And so when the state was at the bargaining table with the union coalition, one of the challenges was, what is an ideal, or what are the pros and cons of various potential data sets? And although the Department of Retirement System we're looking at the prior state fiscal year. So, you're looking at earnings from, mid-year 24 through 25 for a benefit that's in January 26, seems a little bit divorced from time. One of the strong values of the DRS data is that it is data that is already reported by K-12 districts to the state. And DRS, for pension purposes, has a robust scrubbing of data and auditing of data and cleaning up of data, because they need that for purposes of pension actuarial purposes. So from a cleanliness and fairly comprehensiveness data set that didn't create a new burden on districts and didn't create yet another data set for K-12 at the state, with the healthcare authority suddenly having yet another data set that could be salary information on K-12. The idea was to be more efficient and coordinate with another state agency, and so this DRS data was selected. This is the first year of the benefit, and we'll all think about the pros and cons of how this all works, and the data set could always change in the future, or the timeframes could change. All of it is subject to future bargaining, but for the launch of the benefit, this was seen as a good proxy that was a robust, clean data set that exists today. This has obviously prompted some questions, and there's some FAQs that members and districts have asked about this, like, what if somebody's hired later in the year? Like, what does that mean? And so Kelsey will go through some of those, but I did want to address, like, where did this concept of DRS come from in here? And it was just, there were a few data sets that were looked at, and this was seen by the state as one of a very reliable data set to be able to work from. And again, there was a goal to not create more administrative burden for districts. And that was definitely at the table on the state side's interest in developing this. You also see that this benefit is for both represented and non-represented employees. That's because the amount of the K-12 system that is not represented is really small, and the administrative complexity of trying to carve out that part of the system was just seen as not an important feature of this. And so if there are some non-represented employees, there was an acknowledgement that that is acceptable within the context of something that is bargained on for a collectively bargained benefit. And then you might also wonder, like, where did this whole idea come from? Because we've definitely had some members at a conference that Kelsey and I were at talking about this benefits, like, where did this come from? This is a great idea, was kind of the assertion. It's actually been a benefit that has existed in the PEB program under the PEB collective bargaining agreement for I think 2 or 3 cycles now. And so this was kind of an example of, looking at your peers' homework and going, hey, I like that. And so, that was something that had existed in PEB. And so the sub-labor unions were aware that it was something in PEB, and they said, can we do something like that? So in PEB, it was really generated as an idea from the Inslee administration wanting to find something to help provide a benefit that's healthcare related that targeted lower income workers. And so that was really, the charge at the original PEB bargaining table is there something that can be created and offered? And a lot of times an idea is germinated outside of the agency, and then the agency is charged with other ways that we might be able to do this. And so the agency came up with this as a potential way, and it was agreed to by everyone in PEB, and it had been going really well in the PEB program. If you try to stack up the eligibility criteria and the benefits, the structure is the same, but the eligibility requirements are different. There's a lot more part-time workers in K-12 than there are in PEB. So we actually don't give this benefit to non-represented employees in the PEB world, because about half of PEB employees are represented and half aren't. So that is a significant difference from K-12 to PEB agencies and higher education institution, the earnings and salary thresholds are different. In part, the lower threshold here is because there are more part-time workers. So if you had the same dollar threshold, then you would be capturing a lot more people. And so, you kind of start with your budget of how much is being invested on this, and then you back into the levers of what's the earnings threshold and what's the benefit level. The benefit level is also different, but those are features of what is bargained at the collective bargaining table. So just a bit more kind of like, where did this all come from? How did we get here? And now, next slide, Kelsey.
No, that's great. Thank you, Dave. Yes, eligibility criteria, determining eligibility. So the Healthcare Authority and the Department of Retirement Systems work together to determine the eligible number of school employees who receive the benefit. First, DRS sent HCA school employee earnings data about non-retired, active, and terminated K-12 school districts and tribal compact schools, educational, all of them, and their retirement plans to HCA. We applied, HCA applied that $40,000 limit to the earnings data and compared it with January 2026 enrollment information to determine which school employees met that eligibility criteria. And then we sent, HCA sent a final eligibility file to Navia in mid-January to make $200 available to eligible employees. And then they sent their member welcome letters and they loaded accounts for the funds and sent out debit cards. And I'll go into that a little bit deeper in a later slide. Okay, next one. Okay. I think I talk about it on this slide, actually. So this is, I'll talk through how the eligible recipient will receive the $200 FSA this month, in January, sorry, and how it works together, or how it's kind of perceived through the member's lens. So in late January, early February, Navia will, they sent a welcome letter to the CBA FSA recipients that explained how to use the funds, why are they receiving this benefit, when to expect the FSA debit card. It also informed them how to look out for the debit card in the mail. It came in an unmarked envelope, and how to manage their account. So new recipients received a debit card that they could use and spend their FSA funds on eligible healthcare expenses right away. If a recipient already had an FSA account and an active debit card, they just received their customized CBA welcome letter, not a new debit card. A new debit card would automatically be sent to members at no cost after 3 years after it's expired. Participants are able to use the Navia website or the Navia SEBB microsite to manage their FSA benefits and can submit claims for reimbursement there too. And I just want to mention eligible CBA FSA recipients are not required to actively enroll in the FSA to receive the $200. But if they did actively enroll during open enrollment for 2026, that $200 contribution was just added to their existing account. So for example, if an employee elected the maximum FSA election of $3,400 during OE, and then they would have a total of $3,600 to use for the plain year. Right, next slide. Okay, so this slide depicts what the SEB Navia Benefits debit card looks like. As I mentioned before, they receive this. And for many of the SEB eligible recipients, especially for those who do not actively enroll during open enrollment, the debit card might look unfamiliar to them, but we've had positive feedback with members who can tie the debit card here to their benefits. And I think what really helps that is the HCA icon you see on the left-hand side, and then SEB program across the top of the debit card. This helps SEB CBA recipients really make that connection and recognize this is a debit card that's real. It's part of their benefit that was negotiated on their behalf. It's administered by Navia, and maybe they'll just take a look at that, go, what can I do with this, and use it for their benefits. Recipients receive that welcome letter, like I mentioned, right before receiving the debit card in the mail. So the intent is that they read their welcome letter that explains the benefit, why they received it, look out for this debit card in the unmarked envelope in the mail, and then they'll get that debit card with the to use. All right. Actually, go back one more. I'm sorry, go back to that previous slide. I just want to mention that that debit card is a great way to use their eligible expenses at the point of sale. Okay, so that's a nice way and convenient way for them to use it instead of having to go to the Navia website or submit claims reimbursement. All right.
And the fun thing, I guess my definition of fun is always different than most people's. One of the great things about the debit card, the use of the debit card is you don't have to know what's eligible at the point of sale or not. You could be in the grocery store and have a cart of 10 items and there happen to be 2 or 3 that are FSA eligible, and you might know that for 1 or 2 of them. When you swipe your card, it will cover, as long as you have the expenses on the card, everything that is in the merchant system automatically. So you don't have to know everything that is or isn't eligible. And then you will swipe your non-FSA debit card or however you want to pay for the remainder of your purchases. So you don't have to know what is or isn't. Yeah, and you can also use it for your spouse and dependents. So if you're buying things for your household, like you can do a multi-card transaction is basically the point. You don't have to segment and do your first purchase of this and that. And also if you look at your receipts, I guess I think this is fun. If you look at your receipts afterwards, usually there's an F or an X on the left-hand column for most large merchants that indicates it was FSA eligible. And at the very bottom, there's like the summary of how many taxes you paid and whether there was a liquor tax and, there's an FSA eligible designation usually that tells you the total amount that was FSA eligible. So if someone is purchasing things and they go, shoot, I wish I would swipe my card, you can submit for reimbursement with the receipt, and the receipt itself will indicate what was FSA eligible. So if you're ever wondering if something is FSA eligible, just look at the bottom of your receipt. For more, the more you know.
Yes, and to expand on the spouse and dependents piece, a nice perk is they don't necessarily have to be on your health coverage to use the FSA dollars on them. So, yeah, all right. Are we good there?
Yep.
Okay.
Like other fun facts ever.
We have more fun facts. Next slide. Let's go over the FSA plan design. So carryover, and what updates have occurred with the carryover limit. So carryover allows unspent funds to be carried over and made available for use in the next plan year. So the carryover limit has increased for the 2026 year. That amount is $680, as you can see in green here. If folks are eligible for carryover at the end of the year, and that's 2026 to 2027, they will have $680 that will roll over into the 2027 plan year. As we can see, carryover keeps increasing by $20, and the IRS sets the new carryover limit for the next plan year in the prior fall. Okay, so there's a couple of criteria that we have to meet in order to get dollars to carry over. Participants must be enrolled in either the limited purpose FSA or the FSA for the following year, or have at least $120 left in their account on December 31st. There is a sub-bullet. Oh, yeah, or there's parentheses. Okay. So for example, this says that CBA FSA eligibility counts as enrollment. So for example, if there is a SEB CBA FSA recipient that continues to be eligible for the CBA FSA funds, but they never actually actively enrolled during annual open enrollment, their CBA FSA funds will continue to roll over up to the carryover maximum of $680 each year. Okay, so any funds below 120, if they do not re-enroll, or above 680, regardless of their enrollment status, will be retained by the HCA due to IRS rules. So it's a lot there. We can dive into it more if we need.
I'll just say the carryover design, there are multiple design features that under the IRS code that you can pick and choose from. The state transitioned the benefit of FSA to a carryover model in part because of these collective bargaining agreement pieces, because the illustration that Kelsey will go through in the next slide basically reveals that if somebody, for whatever reason, doesn't know about their benefit or engage in the benefit, there are a couple of years where they won't lose the benefit. It will continue to roll over, accrue, and build. And so it gives a longer time for people who have received this benefit under the collective bargaining agreement to be able to access it and ultimately realize the benefit that was afforded to them in prior years. We make this benefit design for the entire structure of the program. We moved to the carryover rule, but a lot of the transition was guided by trying to make this particular CBA benefit a little bit more employee friendly and being able to permeate the psyche of giving somebody money that they aren't expecting and a debit card that they aren't expecting in the mail. You can see some of the challenges that people might have with fraud. And so it's easy to see where they might lose out on money. And this carryover design, although complicated, helps make sure that that money sits there a little longer for them to be able to access.
Yep, that's a great segue into the next slide here. So this table helps depict someone who continues to be eligible for the $200 CBA FSA year after year. Basically what we're seeing here is someone, the example is of someone who does not make any personal elections, but we're also assuming that the current 680 carryover limit and the $200 CBA FSA contribution do not change. The key highlight to point out is that year one, which is this year, since this is the first year the benefit was administered, so like this year and then the next two. So the first 3 years, the person doesn't lose any funds. They would start to lose if they just completely forgot they had it. They wouldn't start to lose their funds until year 4. But hopefully we're going to continue to get communications out there, work with our benefit administrators, work with our union reps to really hone in and make sure that these eligible recipients know that they have their dollars to spend on before year 4. Okay, next slide. So this is the number of eligible recipients for the plan year. This plan year, there were 25,717 school employees eligible. Again, this was based on school employee earnings for state fiscal year 2025 and SEB program enrollment data for January 2026. Slide. So another table here, it depicts on how the CBA recipient utilization, how we kind of track CBA FSA utilization throughout the year. As we can see, there really isn't much right now. They just received their debit cards a few weeks ago, but I will absolutely continue to update these numbers as the year goes on. We continue to monitor recipients who use all of their funds, some of their funds, or none of their funds. We really look closely at those who haven't used any of their funds, and this data helps drive our communication materials. In July, we send out a mid-year letter and target those who hadn't used any of their funds yet, really to remind them that they were awarded the CBA benefit in January. If they had lost the card or don't know where that is, they can call Navia and get a new one at no charge. It's just to help ping those folks that haven't used it yet to say, hey, you got this, please use it. It's for your benefit. We know that those folks that have used all or some, if they haven't used it all, they at least have used some, and that means they know they have it, right? So that's the other two categories. At least they know they have their dollars. Okay, next slide. All right, so here's a communication timeline that dates back to August of last year. We've added CBA information on our HCA and Navia websites. It's been included in webinar presentations. We also created a toolkit for union reps and benefit administrators to use, which I'll talk more about that toolkit in the next slide. In September of last year, we posted that toolkit on the SEB program benefit administrator webpage. We emailed the link out to union reps and BAs. I'm going to say BAs, and that means benefit administrators. In October-November timeframe, SEB CBA FSA information was added to our key open enrollment communications, like the newsletter, our webinars, and forwardable messages to employees. This January, Navia sent that customized CBA welcome letter and the debit cards to the eligible recipients. Dave and I, like you mentioned, presented at the Public School Employees Legislative Conference in mid-January. Seems a while ago. Last month, we sent out an email to BAs letting them know that their eligible employees received the CBA funds and debit cards. SEB organizations and BAs received a file of those eligible employees within their organization. In May, we'll plan to develop a survey for BAs and union reps. And in July, we plan to send out that mid-year letter like I spoke about earlier. And then lastly, we'll continue to develop a survey for the employees. Okay, next slide. Okay, so really as a way to expand awareness and align how multiple stakeholders share information about this benefit, we developed a toolkit. We worked really closely with our comms specialists on this. It's really the central hub for all communications about the benefit. It's live, it's on the Benefit Administrator webpage, and we highly encourage our BAs to use this toolkit. In our Gov Delivery email that was sent to BA's benefit administrators in January, we notified them that they have a file of and where to find that in Benefits 24/7. That includes all of the eligible recipients. And we encourage them to use the communications in this toolkit to target those CBA FSA recipients in the file. The goal here is to really increase knowledge and of the benefit and utilization by those who are eligible, and increase FSA enrollment year after year for SEB employees who could benefit by actively enrolling in an FSA as well. All right. Any?
Yep.
Oh,
Donna?
Yeah, I know that you said that they just got their debit cards, and I'm a huge FSA person. I've used it for years. Has there been any utilization yet that you know of?
yes, there has been. It hasn't ticked down much, but we get a report the first of every month, and for this data particularly, March 1st was the first set of utilization data that we received from Navia. So there has been some, but I can get you those numbers exactly. But yeah, there has been some utilization, which is great. So
Excellent.
not
Thank you.
much, but yeah. Okay. Anything else on that? Okay. Lastly, I just want to discuss the communication plan and the key messages we use to spread the word about this new benefit offered to eligible employees. We talk about an FSA, obviously, and how you can use the funds. We communicate about the CBA FSA eligibility criteria and really try to break that down. How the benefit was established, such as it was a union negotiated benefit during collective bargaining. We also communicate how carryover works with this benefit and what happens if unused funds at the end of the plan, what happens with those unused funds. We explain that recipients will be automatically enrolled in the CBA if eligible, and that we just really want to also let folks know that no action is required on their part, and it does not come out of their paycheck. We communicate that new recipients will receive a debit card and instructions in the unmarked envelope describing the debit card. And lastly, we point out who to contact with questions. So Navia for general FSA questions and to their employer for eligibility enrollment type questions. All right, next slide. Okay, and I can bring up FAQ questions.
No.
Okay.
I just want to see if there's any questions about the general benefit from Kelsey. I do have one more topic to talk about with Navia in a moment, but let's see if there's general questions about what Kelsey's presented.
Just a question about terminations. If someone left mid-year, does the benefit stop as of their termination date?
Yes, so they can use it on services while they were employed. Yeah, but and they can submit reimbursement by March 31st of the following plan year. So they have a few extra months to submit for reimbursement, but they would have to use the funds would have to be used on while they were employed.
So since SEB eligibility ends the last day of the month, begins and ends on the last day and first day of the month, it's about when their expenses incurred and then the additional time. But so they don't lose access, but they have to have kind of a little bit of foresight or kept the receipts or they know they're leaving at the end of the month and then they know their eligibility is ending, so they quickly go purchase things.
Yeah, right.
So no penalty if you spent all your funds.
Correct. And That is actually a structural feature of FSA in regardless of the collective bargaining agreement. What Laura's referring to is, let's say somebody elected the full amount, $3,400, and I'll just do the general example. And this is a pre-funded benefit where all of the election is available on January 1st. And then they say they leave employment at the end of the month of January and they incurred $3,400 in expenses. Obviously, they only had payroll deductions for 1/12 of that election because they have no more paychecks after that. There's no penalty or attempt to recoup money from the individual employee who has left employment. That is partly why the IRS forfeiture process gives money for the plan year back to the plan sponsor, and that's why in this instance the healthcare authority receives the funds that are over that are forfeited at the end of the year. That's one of the risks that the employer takes when offering an FSA benefit to the employer is reduced FICA taxes, but they have this risk of employees, and it happened, there are employees that leave throughout the year in any organization. And if they have not actually had the deductions to fill back their election from the beginning of the year, then that is a liability that exists for the plan. That's one of the questions we get about, well, we try to drive down the forfeiture rate for funds in both the PEB and SEB programs. My personal belief is that especially when it comes to employee elections, it's their money. Let's make sure that they get it as much as possible, and let's do more things to make sure that they're accessing their money. Same, repeat for benefit that the state wants to be targeting through an investment in the collective bargaining agreement for represented employees. But there are forfeitures that happen every year. The two things that forfeitures, we've never gone beyond these two things on what those forfeitures are used for. One, that offsets the liabilities that I just described for Laura's question. Some people who didn't fill back their benefit election amount because they left employment before the end of the year. And the second is the admin rate that we pay Navia for administering the contract. We've never had forfeitures that extend any additional amount beyond those two costs. And Navia historically has told us we have one of the lowest forfeiture rates in their book of business. And I say I want it lower. So what else can we do? So just wanted to share a little bit about that. And thanks for highlighting that, Laura. Other questions about this piece? If not, I do want to talk about something that happened recently that couldn't be in our slides because of the timing of when we were learning about it and working about it, but we began doing a bit of a public notification about a data breach that happened at Navia. So we published information about this notice that we received about a security breach that Navia experienced. We published it on this past Monday and also sent some communications to benefits administrators in both the PEB and SEB programs about it on Tuesday. In essence, the unauthorized access of data was around a 3-week period between mid-December and mid-January, and it impacted about 2.7 million records across Navia's book of business. Of those records, about 35,600 were individuals that are served by HCA programs. That's both, so about 1 to 1.5% of the breach data is data that involves the state of Washington. Navia's book of business is across the country, so it's a there'll be a nationwide notification that comes out. I'll talk about that in a moment. For our populations, we have about 5,600 members that are in the SEB program and about 27,000 members that are in the PEB program. This contract is also leveraged for COFA Islanders, which were a preloaded benefit. It's a separate program that's kind of more under the Medicaid side of the house that used to exist and has much less utilization now, but the data was still there. So it also impacted about 3,000 individuals in that population. The account info that was accessed was really random. It didn't impact all accounts that were served by our agency program. So it's really hit and miss as to who was or wasn't part of the impacted population, but it does go back as far as 7 years. And someone did not have to have a current FSA or DCAP benefit for them to potentially be in the breached data. Because it goes back 7 years, you can do the math. SEB program hasn't been around for 7 years, so this also implicates individual contracts that some school districts had with Navia before SEB was created. There were 37 school districts that had direct contracting with Navia, and so they also got separate notification from the healthcare authority because of those contractual obligations from those historic contracts because of the longevity of data. The breach was a read-only access to data. It didn't allow writing or deletion of data in Navia's system. And for our depending on what services an employer had with Navia's book of business, kind of impacted what type of data might have been in the database that was accessed. So we do not contract with Navia for COBRA administration. We do that directly here at the Healthcare Authority. So as part of their broader notifications about this when they begin towards the end of next week, there may be descriptions of types of data that was accessed that doesn't actually impact the PEP and SEB programs. For us, the largest thing that was accessed, the core data that pretty much when an individual's information was accessed, it almost always included first and last name, social security number, except for COFA Islanders because that wasn't in the data that was sent to them, as that's outside of our Pay One system, date of birth, physical address, and then an internal Navia ID number. Some people, depending on what was added into their account, sometimes by themselves, might include a phone number or an email and then the beginning and end date of the benefits that they had. Importantly, it did not include any claims data or bank account information. So it is a bit more kind of like account level information. But of course, that SSN is something that a lot of people are really interested in making sure is protected. Navia did correct the issue that led to the vulnerability and strengthened participant registration and authentication controls so far. They have an external company analyzing the breach and providing them with legal counsel. They will be mailing letters to impacted individuals, not just PEB, SEB, and COFA Islanders, but everyone, describing what specific data for their account was accessed and obtained and offering free credit monitoring services. Those letters are anticipated to begin sending out sometime in mid-March, maybe as early as the end of next week. And when they do have those notifications that begin flowing, they will also have information about the breach on their websites. They have hired a vendor to assist with caller questions once those notifications are flowing and members may have questions about them. You might wonder about HCA's actions with all of this. Since we've learned about this, we've been in communication with Navia, trying to understand some of the technical natures of what happened, getting a better sense of the individuals that were involved in the nature of the data that was available. We've been reviewing ways to overall limit future data elements that are sent to vendors. This relates to that benefits 24/7 eligibility enrollment file piece that we've talked about with Tanya on the budget, and Travis will talk about shortly here. One of the things that is desired once we are kind of implemented all of the work of the IT streams and moving enrollment file production out of benefits 24 into benefits 24/7 out of Pay One is to no longer be using SSN in our files with all of our carriers as the root unique identifier. So that is also encapsulated within the work that we are anticipating. But we're looking at our other things that we might be able to do just in general to limit data in the streams that go to our vendors. We're going to be adding bidder questions into future procurements to get at this, to have revealed to us in procurements the extent of HIPAA breaches that an entity has had before. That's something that we actually haven't accessed as directly, so we're going to incorporate that to get a better sense of companies' experience in this, or hopefully less experience with this. And then after some of the dust has settled, we'll do some new security design reviews on their IT security measures to look into where they are at this point. So I did want to share that a little bit with the board as a recent development with communications is starting to flow, and see if there's questions I can answer at this time.
Questions from the board? I'll just note, obviously, on the last update from Navia, it might be obvious, but the authority's perspective is obviously we take these things very seriously, and are working very closely and partnering very closely with Navia to ensure that, number one, we're notifying participants appropriately, that they're notifying participants appropriately, and individuals know what to do as related to their next steps and to take advantage of the credit monitoring, et cetera. And then accountability and oversight of our vendor too, as Dave talked about some of those particular steps that we're taking. So couldn't underscore the importance that we, the agency, and under Dave and his leadership, have taken this issue since learning about it. Yeah,
Quick
Laura.
question. We received our letter, the employer, the benefit administrator letter yesterday, just to confirm Navia is sending out communications directly to employers, and we have no need to contact people directly as the benefit administrator.
That is correct. I'm going to answer the two ways. I don't know if everyone realized your question has kind of two different parts. Laura's school district was also one of the 37 that had a contract before 2020. So that's the separate employer notification example that I got. But Navia is doing the notifications for, my understanding, there may be an individual employer in their book of business that has usurped them and wanted to do the notifications directly, but I believe the default is that they are doing notifications for everyone. And for the PEP and SEB programs, absolutely, they are doing the notifications. This does bring to point that there are members who could receive multiple letters depending on if they were in the pre-2020 world and the post-2020 world, and if they switched employers. So there is the chance that somebody could receive quite a few letters, depending on their employment history around all of this. But as far as I'm aware, there's not something that an individual school district needs to do, even for their contracts that existed prior to 2020 that they directly held. And absolutely, there's nothing that benefit administrators are expected to do for communication about this for the SEB 2020 to today world.
In the Gov delivery message, we gave BAs a heads up that there could be multiple letters that.
Yeah, we wanted benefit administrators to be aware of this, and we will send a copy of the template letter that is going out for PEB and SEB once we have the final version of it and we know the information is beginning to flow, so that you're aware, because we anticipate you'll get questions from your own employees, but there's no, for the legal compliance notification process, there's nothing that a district needs to do.
Other questions from the board? Kelsey, thank you so much.
Thank you so much.
Yeah. All right. With that, we now are going to honor our 10-minute break. And so we will reconvene at 10:45. Have started the recording, and we are gathered back in the room, and we're going to go ahead and get started with the next portion of our agenda. And we are pleased to welcome back Travis Cherry, our CIO, who's going to give us an update about Benefits 24/7 and the systems modification. Obviously, you heard in the budget update, really good news. We are hopeful about the budget progress of continued more investments into our work into Benefits 24/7 and system modifications into this for the future. So I think it's Dave's perspective to bring Travis at regular meetings so that we can have line of sight and transparency around some of the IT systems that are being improved here at the Healthcare Authority under Travis's leadership. So with that, Travis, I'll turn it to you. Tab 7.
Good morning, Ryan and board members. My name is Travis Cherry. I serve as the Chief Information Officer for the Healthcare Authority. Last month, I introduced several new initiatives aimed at enhancing your experience with Benefits 24/7. I covered several topics such as our architecture review process, API development, the migration from SOL to wall.gov, and improvements to the 834 slides, or 834 files. Today, I intend to outline both the status and the future direction of Benefits 24/7 platform and share updates on the progress we made since our previous meeting. Next slide, please. In today's brief, I'm going to present a current and future state diagram of our application, for which serves your needs within the 24/7 platform. We're going to go over a couple of workflows very briefly, and I have some outstanding news to present regarding some proposed start dates for some of the initiatives that I had briefed last month. Next slide, please. Go to the current state, please, Dina, if you don't mind. Okay. Yeah. Currently, this is our current state of 24/7. It's a very high level diagram. We took a lot of the technical jargon out for ease of understanding. However, this diagram currently illustrates a complex process and multiple systems integrations. The arrows indicate the flow or direction of the process, connecting the various systems and applications to show the interactions and dependencies. Overall, the current visual representation effectively conveys the complexity of our current system. As users and super users of the 24/7, I would be remorse to say that I understand the concerns and the issues that we have on the technology front just by looking at the current state, right? You can just pick an area. You know, we could go down from subscribers to benefit administrators. You know, currently we have to go through Sol, right? Then it transverses into the Business 24/7 application. And then from there, it takes several off ramps to go to different areas to consolidate the information, right?
Travis, before you move on for this, you know, some of the features that I see here, because I know, again, my definitions of favorite and fun are strained, but I really enjoy this slide because we were trying to find a visual representation and it packs in a lot of information. In it, while it is complex, it is a very good high-level summary of how things are working. We've talked about that there are these two main systems, Benefits 24/7, the blue circle, and Pay One, the green circle. Pay One is something that is entirely at this point internally, almost entirely internally focused with HCA or other state systems. Some entities, especially in the PEB program, have view access into there, but the vast majority of individuals outside of the agency no longer really interact with that Gerald Ford Atari-based system, as I like to call it. They interact with Benefits 24/7, but you see, if you follow the bottom arc from eligibility and enrollment file system file transfers, HRMS, that's the state HR system, higher ed, and then we have specifically different ways that we do information with UW and WSU. You see that directional arrow of data flowing UW eligibility enrollment data into Pay One. That's one of the specific APIs that Travis highlighted last month, because data for UW flows still into Pay One, whereas everyone else's data flows in and starts in Benefits 24/7. And so if we are going to migrate more function out of Benefits 24/7, we have to get UW data flowing the same way as everyone else's data. When you look between the arrows between Benefits 24/7 and Pay One, you see the sync file. That is the circle that is the embodiment of all of the topics that we talked about in the last year when we say data syncing between these two systems. That sync file is the heart of pushing the data from the 2020 era into the 1970s era system that we've had those challenges with. And then in the future state, you'll see a lot of these pieces change. And you'll also notice that there's two different ways that eligibility and enrollment data flow, and those are kind of in the northeast quadrant, the top right quadrant of this chart. Some data for life and LTD specifically flows to the carriers directly out of Benefits 24/7. But the 834 files, which is medical, dental, vision, flows out of Pay One. That's when we're talking about 834 migration, we're trying to align those so that they're all coming from the same place in the same file structure. So that's just a couple of examples of some of the relationship, and Travis will go through even more of that, I think, when we show you the future state diagram. So just wanted to talk through some of the pieces that I see here.
Before we move on, are there any questions regarding our current state or the diagram at this time? Yes, ma'am.
With the sync file, I see the arrows only going one way. At one point, wasn't there some cleanup work that they were trying to do with comparing Pay One data to Benefits 24/7 data?
Yes,
The
and
other
I will
direction.
address the sync file. In fact, I have a topic all by itself for sync file during this brief. Thank you for the question. Any other questions before we move on to the next slide?
I will, just a pre-answer to Laura's question. The data still for sync file only flows one way, but we're comparing the two pieces. So there was never a reverse sync, if you will, for all. We call the UW, you see the UW eligibility enrollment file flows in the opposite direction. We call that the reverse sync, but that only applies to UW. Otherwise, there's not data that flows from Pay One into Benefits 24/7. We compare, and then we try to correct on Benefits 24/7, sync, test, rinse, repeat.
All right, thank you. Next slide, please. For the future state, definitely going to highlight a couple of items. We're going to look at the streamlined process by maintaining multiple integrations. Laura, back to the sync file discussion, right? Have some details regarding that. API development and some timelines. Secure Access Washington to wall.gov migration. That is the solve replacement. I have an update for that as I briefed last month, and a status for 834 enrollment files. Next slide, please. The diagram that is being presented at this time is the future state. We really would like to highlight the level of effort with the wrenches, right? So those areas are in which that we have either work program to work to improve, enhancements, and in some cases, just overall enhancements, right? To kind of clean up it's kind of hard to show a comparison of side by side between current state and future state, but you can kind of, if you, in your books, if you go back and look at the like 24/7 and pay one, there's a lot of the arrows of the past that have been eliminated as we are correcting the data flow going left to right or west to east, however you want to look at the diagram. So,
Travis, the other thing that strikes me is basically almost everything is touched in our systems. There's a wrench or work, not a, it's a work to be done pretty much everywhere, except the very end of the chain of all of our systems, which is the accounting process. That's the lower right, the financial reporting data. So nothing about our accounting processes is anticipated to change. And when we say future state, we're targeting next fall, fall 2027. After that, we would then be working and looking at the retrofitting and modifications on the accounting part of the equation. The way I have historically thought about these programs is we have the enrollment process, the eligibility files process, and the accounting process. Enrollment has been in benefits 24/7 for the beginning for the SEB program, and as of last year or 2 years ago now for PEP. We're now have a project that's focused on eligibility files and all the things that have to be done in order to reach that goal. And then after that work, after fall of 2027, we will turn towards the planning and development of replacing the financial reporting side of the equation.
the future diagram illustrates a simplified process while maintaining multiple system integrations. The list of initiatives we'll be driving our various work efforts simultaneously over the next several months include, go ahead, next slide, please. Sync file. Okay, so this is, I refer to this as ground zero for 24/7 improvements because we know if the sync files are not accurate, then everything outside of the sync file is going to create errors, right, for the end user and the customer experience. So the technical team is continuing to receive and working on the sync file errors from the which is a top priority to stabilize benefits 24/7. Since our last meeting, our technical team has identified 48 bugs from our initial sync file analysis. 9 hot fixes have been deployed. The team is currently reviewing the remaining bugs and associated impacts. Regarding that last comment, sometimes it takes longer than anticipated because we have to identify regarding the bugs or the errors. Are they independent or dependent of each other? Meaning, is this bug a standalone or is it causing something else? So it's a cascading effect down. So, but the team has been doing an outstanding job of getting after some of these sync file errors. Our technical team will be wrapping up the assessment phase on the error file analysis, sync file analysis, and accounting errors by mid-March. Here in another week or so. And then recommendations will be reviewed and presented to myself, Dave, Gene, and a few others, our internal steering committee on or about March 15th, right? We're waiting on some additional analysis to be completed before we do a roll-up with our sync file initiative. Next slide, please.
One more thing on sync files. I'll just say this work is still important because you'll notice even in the future state, a sync file is needed because we're not doing anything on changing the accounting system until after the current project. So although, you know, it might be, while we're trying to move upstream the eligibility file production so that it isn't subject to the sync file process, we still will always have a sync file process until Pay One is fully retired, its accounting functions are retired. So it's still important to maximize the efficiency of the sync file and reduce errors, because even after October 2027, we would still be reliant on a sync process, you know, back to the Ford era Atari system.
So in this future state, Pay One is still part of the system, but there's a future state when Pay One is eliminated with replaced with something else?
Yes, a future. I'm reminded Allison and Terry of when is final, when is future. In the early days, we had a lot of conversations. Is this final or is it final? Now we're talking about the future and the future.
So I have some good news to report for our API development. Our API development or application programming interface for synchronization enrollment has begun. Right, we have identified, according to our current work plan, we've identified API development for special open enrollment, OE, API plan types, development for newly eligible changes, and API development for LTD, long-term disability. So we are starting to populate our milestone chart as we develop the APIs that are much needed to transition from a current state to the future state that we previously discussed and demonstrated with using both graphics. The intent for next month or the next meeting is to provide some additional details on how the development process is coming along, and then be able to answer any additional questions that you may have regarding our API development efforts.
I'll just add that WSU in particular, they're our close partner on this work at this time. We'll also, after we do some of that initial work with WSU, then be working and bringing University of Washington to the fold, but WSU is extremely excited about this work.
Next slide, please. Secure Access Washington migration, known as SOL to wall.gov. The technical team is collaborating with WATEC, our IT provider, to address the following initiative. We are considering and reviewing a March 2027 for a migration. So we had for this particular initiative, this enhances our security features. Obviously that, we know that there's some known flaws with Secure Access Washington on many fronts in terms of access, troubleshooting from a technical perspective, and even frustration from a customer's experience. We looked at several blackout dates and when would be the best time to migrate to this application. And we are considering March of 2027. So this is something that I'm closely monitoring, not only for PEB, SEB, but for the rest of the applications that the healthcare authority hosts that reside behind the Secure Access Washington firewall, for lack of better terms. So this will be a major lift from a technical perspective, but not necessarily, it should be transparent from an end user perspective. And currently right now we are working with WATEC, Washington Technologies, reviewing their user accepted testing guidelines. And we actually have our hands on the application and we're running it through our internal paces before we start migrating our applications behind into Washington wall.gov. Are there any questions regarding this initiative? Yes.
Sorry, does that mean that some organizations would move at different times? And you could be in SAW and you could be in...
Yes, I'm trying to prevent that, right? So
I just mean with like different agencies.
Yes.
So if we have login because we have employment security department accounts or DSHS.
There's a strong possibility. We have been talking with WATEC about that. For this particular initiative, all the applications that reside behind Saul, whether it's PEB or SEB, and all associated applications that support 24/7 will be migrated at the same time. We are not going to fragment, Navia or whatever, right? It's not going to be fragmented. So there's 4 primary applications that require service code, for which we're working on because of the security levels. And we are going to migrate all of 24/7 at the same time after we thoroughly test, and retest.
So we're focused on the agency level and making sure our light switch is flipped all at the same time. But to your point, Laura, I believe the SAL to WAGov migration is overall planned for around a year. So there absolutely is a high likelihood that citizens would experience needing to enter the WAGov portal for some services until the other light switches are turned on and SAL is retired. It's definitely like a waterfall process instead of a big bang switch. Mm-hmm.
Good question. Thank you for the question, Laura. Next slide, please. For 834 enrollment files, currently our intent is to relocate our 834 outputs from Pay 1 to Benefits 24/7. The time is TBD, to be determined pending completion of other workflows. This is one of the scenarios where this initiative is dependent upon successful implementation of our other priorities that we have previously discussed. And next slide, please.
Travis, I'm going to ask a question for everyone. Of the 4 areas, I think sync files we've talked about where 2 systems need to interact. That one's intuitive. SAW as a multi-factor authentication process. Most people have interacted with that, so are aware of what that is. Enrollment file production, I think, is an intuitive one. But what is an API? Not just the acronym, but like, what is it?
It is a process in which different applications and databases communicate. It is a gateway. I will use the terminology that you use. Your light switch scenario, it is the electrical wires behind the wall going to the fuse box to connect the light switch to your power panel. Hopefully that helps.
Yeah, I think it does. I was realizing, and Katie was suggesting, and I agree. I was like, oh, I can't describe what an API is. So maybe that would help everybody just realize what that work is.
Yeah.
So,
I mean, I just think, for the board's perspective, this is a lot of the indoor plumbing, which is so critically important, right? You said rinse, repeat, etc. So I'll keep the sink analogies, but those graphics around like, here's how the plumbing actually works. None of it works if you don't have this stuff in place. So I think we're bringing this forward because we know we have aging infrastructure in place. We want to make sure that the boards know that this is a priority for us to fix. We want you to have your oversight and awareness into that. And then as we go through these changes, as Travis mentioned, we will test, retest. But it's important for all of you to have awareness so that you can communicate that back out, that we're trying to make some of these critical changes in case there are things that happen along the way. But I just can't underscore how important this is for our agency and sort of strengthening our agency operations to be able to serve in the future.
and along the way, we're going to be able to do some other things. Like I said, wean ourselves off of the reliance of Social Security number as a unique identifier, which is something that we need to be able to do. But when your systems are rooted in such old IT pieces, there are certain things that to retrofit that is basically pulling all the plumbing out and starting over. And so, but we're going to hopefully be able to address some of those longstanding goals that have never been able to really be fully addressed. So that's another piece. Allison?
I'm really excited about the focus, Ryan, that you're bringing to this. I think when we think about how humans interact with their government, it isn't in the siloed approach of this is this agency, this is this agency, this is this agency. So it's really hard, maybe less for school employees, but more vulnerable people when it's so complicated to figure out how to get to those systems. And we haven't seen the state make the kind of investments to get to much closer to universal accessibility for folks. So just super appreciative of your leadership that this is not something we can keep sort of kicking the can down the road and think we're going to be ready for what is coming, both in terms of we've got to get more economically efficient in how our systems are working long term, and the needs Washington residents are going to have to be able to access all sorts of things that their state government is providing. So thank you very much.
Yep. Thank you. Any other? Yeah, go ahead, Travis.
Yeah. To answer Dave's question, to define API, the IT business standard, industry standard, it's a set of rules and protocols that allow two different software programs or systems to communicate to exchange data. Right? That's all an API is. And if you go back and if you reference, or if you have some spare time, go back and look at those diagrams, and you can see the necessity for well-developed, well-supported APIs to continue on with our enhancements in improving customer service for 24/7.
We have multiple players. It essentially allows more automation to occur. And why the WSU in particular is so excited about API work is they're probably represent one of the extreme situations that currently happens, where they have their enrollment of their employees system at WSU. And right now they literally pull up their Workday screen, their benefits administrator, pull up their Workday screen on under screen one, pull up benefits 24/7 and rekey all of the information into our system. Because there's nothing that is tying those interactions together on an electronic circuit breaker at a master switch level. That is not the world that a lot of other employers are in at this but there are efficiencies that can be gained. Variety of employees, actually larger, being able to have a standard API process that we can replicate with other employers. But WSU is kind of at the front of hanging on for a while and very patient, and now they're very excited that we are very engaged in accomplishing this.
Any other comments, questions from the board? Seeing none. Travis, thank you so much.
And thank you for the opportunity to present this morning. Have a good day.
You bet. Okay, I think we've now reached the part of the meeting where we're going to go to public comment. And I think first want to check to see, do we have anybody virtually or do we have anybody signed up in the room for public comment? Not at this moment. And do we have anybody virtually who has their hand up in the hand feature into Teams? You can raise that on the virtual environment. Is there anyone with their hand up, Tina? Okay, we'll give the period. For anyone who's virtual, if you would like to provide public comment, all you do is raise the hand function, and then we in the room will be able to call on you to get audio and visual. Seeing none. Someone coming in the lobby. Okay. All right. Seeing none. We will be back here at our next meeting on April the 9th at the same time, 9 a.m. Also on Teams. Dave, do you have any other comments before we adjourn?
Just my preview of coming attractions. The legislature will have, I'm not even going to say it, Allison. We'll do our next briefing on the legislative and budget process. Yes. I think it's okay to put it out in the world that by early April, we should be done the legislative process and budget process. So we'll have the final results there. I think of the spring as the kind of rulemaking timeline. At this exact moment, I don't believe we have any eligibility or enrollment resolutions that will be teeing up for your action this spring, but we still are doing rulemaking. And so there'll be a briefing about that. There's all, depending on exactly what happens in the next week with the legislature, there could always be a policy resolution that's related to some sort of legislative activity. But you'll have a rulemaking briefing, and we'll do the refresh on, we're about to go into rate setting season. So what's that whole process look like, and a reminder of kind of like what that process is. And then Travis will be back. So that's just a couple of things that we know will be on the agenda for next month.
Great. Any questions? Meeting adjourned. We'll see you in April.